Imagine looking in the mirror and noticing one of your eyes suddenly seems to be pushing forward more than the other. Or perhaps a loved one points it out to you and it was not there before. This can be quite alarming, and it naturally raises an urgent question about your eye health. Yes, a sudden bulging of one, medically known as acute proptosis or exophthalmos, is absolutely an emergency and requires immediate medical attention. It is a critical symptom that signals something serious is happening behind or around the eye, and it should prompt you to seek urgent care without delay. The urgency stems from the potential for significant underlying conditions that can rapidly damage vision or even pose a threat to overall health. A sudden bulging eye is not just a cosmetic issue. It indicates increased pressure or a mass behind the eyeball. This pressure can compress the optic nerve, which is vital for transmitting visual information to the brain, potentially leading to permanent vision loss if not addressed quickly. Conditions like an orbital cellulitis, which is a severe infection, or a hemorrhage, which is bleeding, or even an aggressive tumor, can cause this rapid forward displacement of the eye. These requiring swift diagnosis and intervention to prevent irreversible damage. If you experience a sudden bulging, your immediate action should be to go to the nearest emergency room or an urgent eye care facility. Do not wait to see if it improves on its own. When you arrive, describe your symptoms clearly, including when the bulging started, if there was any injury, and any other accompanying symptoms like pain, changes in vision, double vision, or fever. The medical team will typically perform a thorough examination and may order imaging tests, such as a CT scan or an MRI, to identify the precise cause behind the eye. This quick assessment is crucial for guiding the correct treatment plan. This condition is distinct from chronic proptosis, where the eye protrusion develops slowly over time, often associated with thyroid eye disease affecting both eyes gradually. The sudden onset in one eye is the key indicator of an acute problem, demanding prompt action. Your eye care team will be looking for specific signs such as limited eye movement, redness, swelling, or changes in pupil reactivity to differentiate between various urgent causes. Recognizing this distinction helps ensure you receive the appropriate and timely intervention for what could be a sight or even life-threatening condition. Prioritizing immediate professional help for a sudden bulging is paramount for protecting your vision and your overall well-being. Acting quickly allows medical professionals to identify the underlying cause, which could range from a treatable infection to something more complex, and initiate vital treatment to prevent complications, preserve your eyesight, and address any systemic health concerns. It ensures you receive the care needed to resolve the emergency safely and effectively.